Things with Medicare. Oh, you ready? Okay. One of the things with Medicare is, well, I guess first of all, I'll tell you, I really appreciate y'all coming. Appreciate you having us. And Medicare, what we're doing is this is our wealth management class, and the students are working to get their license in insurance, and they're going to work on this semester for their life and health insurance, and then next semester it'll be their property and casualty, where they can do homes and cars. So a big component to the life and health is Medicare, is health insurance. And so by doing this, Pastor Webb and y'all helping us, is that they're able to learn, the different parts like deductibles, copays, all that kind of stuff where it's not just, memorizing. It's actually in place, and we actually have people that, it's important to. And so, really appreciate that. But we also have a company that we've partnered with, so if you ever want to speak to an agent, just let us know, and I can, get you with somebody. They actually gave us all these materials that we've been working on. So one other thing is that, you need to make sure that you understand how that, One of the things that's best is to know that how it affects your pocketbook. Because as you're going to see as we go about this, is that there's a whole bunch of different costs associated with Medicare that, some plans have more and some plans have less, and we'll go through a lot of that. But basically we want to get you enough information where you feel comfortable picking a plan, and also to be able to answer the questions like I was talking to you earlier about being able to talk to an agent and not being overwhelmed, because they're going to ask a bunch of questions, and you're going to have to know, answers to those, because that's how they're going to fit you into what policy is most important. And, help you save money. But this is also, like I said, to help our students understand health insurance and Medicare, and to eventually have the student, they're going to participate today, but then also they're going to eventually do their own. So like as we go along, then they will be doing what I'm doing. Now, as far as signing up for Medicare, that I don't know if you understand, that goes, you get to sign up 3 months before your 65th birthday, and then 3 months after. Am I in the? Okay.
Let me move this over.
Is that better? Okay, so what you do is you'll sign up for Medicare 3 months before your 65th birthday, all the way until 3 months after. And of course, you really want to do that, because if you don't, after that 3 months, you get a penalty. And it can be as much as 10-15% of the premium that you're going to pay. So it's very important that you get it done. Now, if you currently have insurance, there's also, like through work or through your spouse or anything like that, there are certain ways that, these things, you have special enrollment periods and things like that. So, but for the most part, this is when you want to sign up. And then the second thing is that every single year between October 15th and December 7th, depending on, if they fall on weekends or not, is when annual enrollment starts. So as you get better at this, you'll understand, hey, you can, as your health needs change, they can shop. You'll be able to shop the different plans, because maybe you'll get on a plan, you like it, but maybe you've heard from someone else, you can kind of see what that is, but you'll start to understand what Medicare is paying for. But each year you'll be able to shop during this open enrollment. Okay? Now, one of the things is we want to talk about the different parts of Medicare. Understand prescription D coverage, because prescription D is your prescription drugs. So that's one of the hardest parts, and that's where a lot of the money comes from. So if you look at all the ads and all the political things about Medicare, you're going to see always prescription drugs are coming up. Key terms and benefits, how to look for your 2021 options, and then how to use Medicare.gov. Okay, and then, like I said, knowing what you're going to expect with agents. Now, Medicare Part A is when you have, it's like hospitalization. It's a very basic coverage, but every single person gets Part A when they turn 65. So that's something that just, you get it. As long as you paid into Social Security, you're going to be able to get Medicare Part A. Now, Medicare Part B is where you actually have things like the doctor's visit, specialist, mental health, ambulance, things like that. Now, those two together is what they call original Medicare. And so anytime you hear the term original Medicare, those are the two that they're talking about. Now, the second part, there's a premium each month for that actually, if you're on Social Security, it comes out of your Social Security check. So you don't really see it, but everybody pays the same. I think it's $145 this year. But you pay that, and then you'll have Part A and Part B. But you do have to opt into Part B. Now, Part C combines these two, and it's sent out through the private market. So that's where you see all the commercials on TV with Blue Cross Blue Shield, Humana, United Healthcare. That's Medicare Advantage Part C. And so what that does is that they take that premium that you give to the government and they give it to those companies who run the program. And so what they do is now, because they have that, they can compete, and they compete for your business to offer more coverages, more options, and different things, just wherever you fit in, what's important to you. There's a bunch of different choices with Medicare Part C. So that's when I do this, I'd like to focus on is the Part C, because if you pay into Medicare Part A and Part B, there's no maximum out of pocket. Okay, and we're going to talk about the maximum out of pocket here in just a second. But then prescription D are drug plans. Now, you can get a standalone drug plan, okay, but you can't. But a lot of these Part D plans offer a drug plan. So when you see that. That's another thing. You're going to be asked by the agent when you look at it, do you want prescription drugs? Do you want this? Do you want that? But prescription, you can get a Medicare Part C without prescription drugs. So in a situation that maybe like retired teachers get a Medicare Part C plan. So when you get that, because you paid into TRS. Now, it actually has prescription drugs. Okay, but some of those that go through a job, like that, they don't have prescription drugs. So you would have to buy a standalone program or standalone plan. Okay, now here's the thing is, if you look at maximum out of pocket, it was on that other sheet too that I explained a little bit more. But on here, Tyrese, on the maximum out of pocket is the biggest thing is that this year, the maximum out of pocket for any plan on Medicare Part C Advantage is $7,550. Now, most of these plans charge less than that, but that is the most that the federal government allows these companies to charge for this, is $7,550, okay? Now, so, and that's in a calendar year. So basically, if you have like a heart transplant, then that's the most that they can charge you for it. So that's the maximum out of pocket. Now, and this applies to essential benefits like deductibles, co-insurance, co-payments, and such. But it doesn't include things that you get extra, that you can get extra, like vision plans, dental plans, things like that. So if you just think like most of the things that happen in your regular doctor's office, that stuff is part of this. But if it offers you a $2,000 dental benefit or a vision, that doesn't go towards the $7,500. Okay. And like I said, that original Medicare that we talked about before, Part A and B, it doesn't have a maximum out of pocket. So if you didn't have a Part C, and let's say you got a heart transplant, then it's going to cost you whatever that heart transplant is. Okay. Okay. Now, if you look at Part D, it's one of the most confusing parts. Okay, because Medicare Part D will have they have different tiers. So you'll have Tier 1 medicine, Tier 2 medicine, Tier 3, all the way up to Tier 5. So and they will each have their own deductible. Now, Part 5 are those really expensive drugs that you hear people taking, and they could have up to like a $250 copay. Now, they have Part D also has a part in there where you're going to pay the amount of money up to like, I think it's over $3,000. And then after that, they're going to start paying, the insurance company will pay 80%, you'll pay 20%, and there's no cap on that, okay? It's good because you're not paying the whole amount, but you're looking at, it's still, a lot of money. So once you hit the 20%, that's what they call the donut hole. So now you're still paying 20% of what is happening to you as far as your prescription drugs. So if you have a lot of prescription drugs, this is going to be, it could get higher. But if you have regular things like, high blood pressure, that's not expensive. If you have, like my father, he takes a lot of prescription drugs, and you can go to Medicare Part Gov and see what you've done. And I think they estimated that his total out of pocket is like $3,200 a year, which sounds like, it's a lot, but if you knew how many drugs he took, you would think, that's not bad. So it does take a lot to get those numbers a lot higher. Okay, so what we've done is that I've given you this, and these are some of the things when people ask you, it was on that sheet, that when you talk to someone, these are going to be a lot of the terms that you're going to have options for. So as you go through a policy, as you go through choosing, they're going to give you a bunch of options, and they're going to say, this is the specialist deductible. This is the primary care deductible. This is the prescription drug deductible. This is what it's going to cost for an MRI. This is what it's going to cost for an X-ray. Lab tests, depending on what they are. Radiation therapy. Vision benefits. So my thing is that there's a whole bunch of them. So once you start to see those are mostly benefits. Just don't be overwhelmed, because there's going to be a lot of choices, and some of these aren't going to matter to you. And so if they say, you've got a hearing aid benefit, but they've never really affected you, it's not a big deal. So, just to let you know that all of these things are things that are in the policy, and that's how you can compare them. But I always tell people, you need to know what's important to you on there. All right? Okay, so basically on here, you're going to need to know how, and I'm going to go through how to search a Medicare policy, but there's no best policy and there's no one-size-fits-all, because what I've gathered through this, that people will say, what's the best Medicare policy? There is none. It's what's best for you. There's no one-size-fits-all. Pastor, says, no, well, what should I get? No. You got to answer questions, and you got to find out what's best for you, okay? But so, if you see it, put understanding your situation. Okay. Now, here's where we really come for the differentiations, okay? If you look at an HMO, okay, I think we talked about that today, is that an HMO is just the old HMOs. It's the health maintenance organizations. Now, HMOs, you're going to have a primary care physician. Some people don't care. Okay, some people don't want to have a primary care physician. They want to be able to go to a specialist whenever they want. Okay, so if you want to go to a specialist without being referred, then an HMO is not for you, because that's the big difference between the two. All right, but and you have to stay in network. But you're going to see, though, when we talk about this, that you're probably going to want to stay in network even if you do a PPO. Okay, but an HMO is normally going to be cheaper, and you may just, when you pay your Part B deductible, a lot of these have, Part D premium, a lot of these have a $0 premium attached to it. You just sign up for it and there's no extra money. Most of those come from the HMO, okay? And then a lot of them will cover prescription drug benefits, and there's a lot of them that have different add-ons, okay? Whoops. And then a PPO, the benefit of that is that you don't have to see a primary care physician. If you feel like that you need to go see a cardiologist, you can just go straight to the cardiologist. If your knee hurts and you want to go see an orthopedist, you just go straight to the orthopedist. Now, this is usually a little bit more money, and the maximum out of pocket is usually a lot higher, but it gives you freedom and flexibility. So those are some of the things that on there. Okay, so you want to come up here, Tyrese, do this one? And you can stand here like this and look at it. If you want to just read it from up here, you can. Like talking to the mic. You use this. Go down.
This one.
Yeah, click it down.
Oh, does it matter what things to look for?
So these are some of the questions that are on there that you need to know that is important determining, number one, what add-ons you want, and number two, if you want an HMO versus a PPO.
Well, questions are, does it matter if your current doctor is not on the plan? And do you mind having to get a referral from your primary care physician to see a specialist? Do you want price over flexibility, or would you prefer flexibility over price? What are your primary care physician and specialist deductibles? What hospital coverage is for the plan? And what is the maximum out-of-pocket for the plan?
Do you want the plan to include prescription medicines? What medicines are you currently taking? Do you want dental coverage in a plan? Do you want vision coverage in a plan? Do you have a Medicare Advantage plan through your employer? Is your spouse covered under that plan? Does your employer plan cover your spouse? If so, is there an added cost?
So, like, when you go and you speak to someone, these are things that you're going to need to know that you want to ask and that you want to answer, okay? Okay, now, another thing, too, is when you go to Medicare.gov, you're going to see the star ratings, and it's just like Amazon, where you go on there and you see something, and it'll say, oh, 5 stars. Now, sometimes you see a good deal, but there's no ratings. Well, it usually takes 2 years for the policy to catch up on Medicare.gov. So, like if you go up there, you'll see some good policies because they're new. And what they've done is that they haven't had time to get rated. So then you have to kind of go back and say, okay, have I heard of Humana? Have I heard of United Healthcare? Have I heard of Blue Cross Blue Shield? And there's going to be some that you may not have heard of. So you might want to look into those companies. But a lot of them will have star ratings, and they've been around, and it's just 1 star to 5 stars. So once you do that, you're going to want to make sure, if you see a policy and it looks too good to be true and it has 2 stars, kind of like Amazon, I stay away from those things, okay? All right. Now, okay, so this is kind of important because this is a plan finder. So if you look at this sheet, what I've done, I put each one of these sheets on here, and I've circled it just like on my page. So what you can do is you can go to Medicare.gov. Once you're within the 3-month period you can go to Medicare.gov, and you can start looking around for policies on your own, all right? Now, if you look here, I put it on here. You'll go to Medicare.gov, and then you'll go preview the health and drug plans. Then you'll go to log in or create a login. So once you get your Medicare, your Medicare number, you're going to be able to log in, and you're going to be able to see the different things on here. Now, because you're not on Medicare, it's not going to pull your medicines like I'm going to show you on here. But it is good to go ahead and log on and get that, so the next year, if you want to shop it, it will have all your prescription drugs that you get through Medicare, which would be all of them, on here, okay? So once you go on, you log in, and then it's going to ask you a few questions, okay? So it's going to say, what do you want on here? What type of policy do you want? Well, I chose Medicare Advantage Plan, this top one right here. Then it's going to ask you, click on here, and I'm going to put my zip code, and I hit continue. Okay, now, once I've done that, it's going to ask, do you want to pull your medicines? Well, these are all, I use my dad, and that's, you can't really see his medicines, but I did that. But these are the ones that he has. So it's going to give me not only how much the premium, how much the copays, all that stuff, but it's also going to give me an estimated amount of how much he's going to pay for prescription drugs. So when you do that, then you're going to put in there what pharmacies that you want, and you're going to give your zip code, and it's going to pull up the nearest pharmacies to them. Okay? Now, then here it says here, 45 Medicare Advantage plans. All right? And it talks about, this would be the yearly drug and premium costs right here on this. And this is the added monthly premium. So if you can tell, though, this is an HMO because they ended up, it doesn't have a premium on there. All right? And this would be the drug plan. Now, if you go here to filter right there, then you're going to see on here all of these things. And I clicked on, I wanted all of these. I wanted vision, I wanted dental, I wanted hearing. They already had transportation, but I wanted telehealth, okay? And so you click on all of those filters, and it's going to pop up all of the different the plans in your area, okay? Here they are. Here's all the things right here, okay? And so that's when you start to do that, then you can start to filter, okay, I only want 5 stars. And so you can have an idea of what you're looking for before you actually talk to someone. See, I believe in talking to someone because then you can say blah, 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 blah. And then you have an idea of, okay, well, no, you understand what maximum out-of-pockets are. Okay, you're okay with an HMO. Okay, and you know that an HMO, the maximum out-of-pocket is going to be $3,500. Well, they try to put you on a PPO that's, $6,500, and you're fine with going to a primary care physician, then, you're going to want to steer them back to, what is good for you. Or maybe, y'all want vision, okay? Well, there's a lot. You're not going to really want to see the policies that don't have vision on there. So that was, but then, so then also there's a low-income subsidy for anybody who qualifies, and if y'all know of anyone, I can get the forms and stuff to Pastor Webb, and it deals with Medicaid, but Medicaid and Medicare work together. So all of these things, just because someone is on Medicaid, they still get the Advantage plans. So, and this is what I printed off. This was they sent to my dad's email. And it says, they're going down, plans are going down about average of 34%. And so the reason I say this is because you have to get over the pain. The hardest part, like once you pick something, you're going to be into it. But then after that, are you really going to go through that the next year? Well, like for me, I shop my home and car insurance every year because I know what to look for, number one. But number two is that, I want to save money. And I'll say 2 years ago, I saved like $1,200. Year before last, I saved like $800, and then this year I saved like $300. Of course, my son's getting older, so that helps me. But still, I shopped it. And, once you do that, and the same thing with this, is that you don't want to miss out on a better, like maybe price isn't your thing, but maybe there's a lot of benefits. Maybe there's added benefits. So that's your thing. So that's the reason, like, if you keep in, here and do that, they always say, can you get over the pain in the rear factor in order to save yourself some money, okay, on there. But anyway, the final thoughts is that when you speak to someone, they're going to have to fill out what they call, this is through Social Security Administration, CMS, Medicare Services, and what they're going to do is you're going to have to fill out what they call a scope of appointment. So when you talk to someone, that's all they can talk to you about. So if you say, I just want to talk about Medicare Part C, or I want to talk about Medicare Part C and the prescription drug, they can't talk to you about your annuities. They can't talk to you about your retirements. They can't talk to you about anything else. The only thing they can talk to you is about this, okay? And so I say that if someone tries to talk to you about that, you need to contact me, okay? Because I will report them. Because that's one of those no-nos. They have to, whatever they say you're going to talk about, whatever the agreement is on that scope of appointment, that's it, okay? So, but anyway, the idea here is to do what's best for you, make sure that you understand that when you're picking something out, that all of these questions I have, and you may have some more on there, that you have answered, so when you go in to speak to someone, when they ask you those and they're bombarding you with questions, you don't feel overwhelmed, okay? So if you don't get anything else out of this, hopefully you get that there's a lot of choices, but once you start whittling down those answers, you're going to have an idea about what you're looking for, okay? All right, and thanks for supporting us. We really appreciate it. You know, go MacArthur. Go Cowboys. Yes, sir.
Okay, so on that scope of appointment,
Uh-huh.
so in other words, they can't start talking about, if you're like, you're retired, it doesn't affect anything that has to do with your Medicare doing. In other words, like for instance, Social Security, I've heard people say that, like when you're retired, and you got a retirement like I do, I retired, then the Social Security is gonna adjust to your retirement, something like that. Does Medicare have anything? Like
No,
that?
you're talking about, yeah, okay, so like a teacher, if they have what they call the windfall, so if you have a public pension, whether you're in the government or whatnot, then, yeah, they have what they call a windfall, but that doesn't have anything to do with Medicare. Yeah, yeah, I see what you're saying. Yeah. Does anybody else have any questions? Yeah.
Age difference?
No, it's not banded by age.
No, well, we have an age difference.
Oh, okay,
You know, I'm already 69.
okay,
She's gonna be 65 in April.
okay,
So I've signed up for Part A,
okay,
but I have not signed up for Part B because I'm still working.
okay.
So,
So I'm not sure what the rules are on there, but once, you can't have Part B while you're working,
right,
okay? But I want to say it's 90 days after, you have 90 days until, you know, from the time you quit in order to sign up for a policy. That's a special enrollment period. So when you retire or resign and you don't have the benefits anymore, then you have 90 days to sign up for Medicare. Now, if you COBRA, then it's 90 days after COBRA. Does that make sense? Okay, yeah.
but how long does it take? I've heard different things about how long it takes to actually get everything up and running with Medicare and Medicare versus, you know, okay, so I'm employed, like, if I retire in April when she turns 65,
Okay.
if I retire in April, how long will it take for the benefits to actually start taking place?
I want to say within 30 days. It's just like a job. I mean, once you sign up and you have, you know, the dates, because what you're going to have to do is you're going to have to, you know, there's going to be an extra form where you have a special enrollment period. But that's not going to be a big deal because you'll have to get it from your work, just like if you change jobs or something and you'd have to get a deal, you know, a sheet saying, hey, I was covered up until this point. And then when you submit it, you would submit that, but it's, I mean, I wouldn't think it would be over 30 days, tops. I mean, you would still be covered, you know what I'm saying, but as far as getting billed and whatnot, because there isn't going to be a gap by the time you do that, by the time you retire and you start your benefits, especially if you plan for it. Like if you know you're going to retire in April, I would get the ball rolling probably about the time she gets the ball rolling on that.
Which is 3 months before she turns 65.
Yeah, that's when you can, yeah, right. But if you say, hey, I'm going to retire at this, let's say April 1st, I'm going to retire April 1st, then, you know, you can have coverage April 1st for Medicare. I mean, you know what I'm saying? As long as you know, as long as you get everything done in ahead of time. But, you know, the longer you wait, of course, the longer, you know, there's going to be that gap. But, no, you're covered with Medicare. No. Yeah. This is one of the good things the federal government does. So, but, yeah, so, but if anybody, you know, has any questions, send me an email. I'll get Pastor Webb my email. I meant to bring some cards in, but I forgot them. And just send me an email, and if I can't figure it out, I'll find someone who does, and I'll get you the answer. Okay? Yeah, we want to be a resource to the community, you know, especially in people who are going on to Medicare. It would be good if we, you know, the school, you can call the school and, you know, we can figure it out for you. So that way, you know, we can talk the lingo to the people. So as we move on in the future, this would be a good thing that MacArthur is you know, our wealth management practicum is helping out with the community, so.
What was your name?
Jason Lowe, J-Lo. So, okay,
And the good thing about this is, like I said, we just streamed it on our church
Nice.
Facebook page, and then what I'll do is I'll be sharing on my page. I got like about 2,500 friends.
oh, nice,
So about
So
7 of them.
I saw it on the page.
Yeah, and so I'll do the same thing, so they'll be able to watch this,
okay.
and so then you may start getting, you know, a lot more people, you know.
Well, it's jlow@irvingisd.net. Yeah, and so, yeah, like I said, we'll come up with the answers, and we'll be, you know, like, I'll be discreet, like, any questions, I'm not gonna share it with the kids, you know what I'm saying? So, but, okay. Well, hey, I appreciate y'all, okay? All right,
Thank you for your time.
all right, so.